Contract year 2027 final rule is out. Let's talk about it. There's a lot of good stuff for brokers in it, and I think there's a lot of stuff that still needs to be discussed and kind of clarified within some of this. So let's dive in. First one being the reduced call recording retention from 10 years down to 6. But there's an additional caveat here that I think brokers need to know about. So the first 3 years of that is audio retention. The next 3 years of that is going to be transcript retention. Now, if you do an enrollment, the enrollment records is still remaining at a 10-year retention, but now only calls that result in an enrollment have to be recorded. So that's an adjustment from what we've had, but it's not really just a blanket 10-year down to 6 and that's that. So there's an additional caveat there that agents need to be paying attention to within their retention storage records. Here's a big one though. Elimination of the 48-hour scope of appointment. That buffer zone now between taking a scope and being able to have that sales appointment is now eliminated. So we're back to being able to get the scope right before the appointment and then walking right in with the client. Obviously, we still have to have the scopes. Scopes are still increasingly important, especially when we talk about compliance and your records retention. So scopes aren't gone, just the 48-hour delay is. Marketing rule flexibility. This is a really interesting one that I think I'm going to get a lot of positive feedback from the agents on. So that TPMO disclaimer of, we don't represent every plan in your area. We represent 6 carriers that offer 24 products. Please call, ship. The whole disclaimer that we're used to in that under current guidelines is the first minute, that first 60 seconds of a call, that disclaimer has to get read. Now, that disclaimer only has to be read before discussing plan benefits. So that's a shift in how quickly brokers need to address that and when it needs to come up. The ship reference is also now removed, and agents can use superlative terms without supporting documents, but misleading claims are still prohibited within that. So don't get carried away. Don't be flying by the seat of your pants on all of this. Educational event changes. I'm really excited about this one as we've had a lot of agents over the last year start shifting towards T65 and educational seminars and a bunch of events as a way to kind of be that center of influence in their area. So what's changing on that? Beneficiaries may now sign a scope of appointment at an educational event and immediately attend a sales event, eliminating that 12-hour buffer that we used to see in the opt-out period, provided that educational events are still remaining as non-marketing events. There's been a lot of conversations as well around this SEP or this GI window for network disruptions. Well, CMS declined to add a new special enrollment period for network changes unless deemed significant. I think this is going to continue to be a really important talking point as provider disruption continues to feel more and more tumultuous every single year, and kind of the waves and the swings get bigger, but still has to be deemed as significant and is still a case-by-case basis. Star rating updates. We cannot forget about these. CMS has now removed 11 administrative measures, adding a depression screening measure, retained diabetes care, eye exam measure, and a postponed health equity index reward, aiming to better actually reflect plan quality and encourage performance within this. So as you guys know, star ratings make a huge swing in carrier funding. So the way that they navigate this, I think, is going to be really fascinating to watch and really important in plan design going forward. The prescription drug protections, codification of the Inflation Reduction Act. So $35 insulin cap, zero cost sharing for adult vaccines, manufacturer discount program replacing coverage gap discounts, and the $2,000 annual out-of-pocket cap starting in 2025, and the elimination of the Part D coverage gap. So now that this is kind of solidified and codified, I expect carriers to have a better feel for how they're going to navigate this going forward on a year-by-year basis. Flex card rule changes. New rules are requiring real-time purchase verification. They're banning dollar value advertising on these as well. We're eliminating the rollover of unused balances and enforcing spending controls. This is in an effort to increase transparency for the SSBCI or the special supplemental benefits for the chronically ill. This is really important as we've seen a big expansion of the dual special needs market and the chronic special needs market. with that SSBCI verification as we transitioned from the value-based and the VBID design. This is going to be really important to watch, and I think it's going to be huge if you're an agent in the special needs market space that's used to some of that, especially some of that rollover benefit design that we've had in the years. That's changing, and that's going to look different for contract year 2027. And lastly, but not least, is DSNP and other provisions. Some of these changes include exemptions from Medicaid alignment for certain dual eligibles, a 120-day continuation of care for passive enrollees, clarified contract termination grounds, administrative updates, and reduced Linet call center hours. So, exclusion of HRAs from coverage disclosures and enhanced oversight on opioid prescriptions and Part D reporting. Look, I know this has been a long video. I know this has been a lot to cover this, but these details are important and they really shape how you interact with your beneficiaries and how plans and plan design looks for contract year 2027. If you have any questions at all, please call our office at 800-689-2800.